A late-night fast food run. A sudden, excruciating pain. And just like that, an internet star's weekend turns into a life-threatening medical mystery.
Right, you think you're just dealing with a bad burrito, but within hours, you're waking up in an emergency room, rushed into surgery.
And suddenly facing a life-altering diagnosis, the cameras flashed, the crowd froze, and just like that, Hollywood had a new obsession.
Welcome to Starscope Report. Join Jordan and Jamie as they uncover Hollywood drama, music industry shakeups, and viral influencer scandals.
From red carpet surprises to social media controversies, we dive deep into the stories behind the fame.
And for today's deep dive, our mission is to unpack the viral medical emergency of influencer Brianna Chickenfry LaPaglia.
Yes, so we are pulling from a pretty massive stack of sources today. We've got her own YouTube confessional, plus entertainment news from Us Weekly and The Looker.
And to really get to the truth of the physical crisis, we're bringing in clinical medical literature from Korea Med Synapse and VinMec.
Oh, and we're definitely throwing a highly critical Reddit snark thread into the mix.
Yeah.
Because we want to separate the influencer storytelling from the actual medical facts.
Exactly. We want to see what happens when pop culture drama collides with a very real medical crisis.
The contrast between the clinical reality of her body failing and the digital reality of millions of strangers analyzing that failure is, well, it's a fascinating collision of biology and internet culture.
It really is. So let's start with the biology.
Right. Tracing the timeline from her YouTube video and The Looker's recap, this all kicks off on a completely ordinary Saturday night.
Yeah, she and the guy she's dating decide to duck out of their plans early.
They head home around midnight, and they make a late-night Taco Bell run, which honestly sounds like a great night.
It does, but it's also the perfect setup for, completely misinterpreting what happens next.
Oh, 100%.
Because when sudden abdominal pain hits right after eating fast food, your brain immediately searches for the most logical, least terrifying explanation.
It's a cognitive bias, right? You just assume the pain is a direct result of the last action you took.
Exactly. So about 15 minutes after eating, her stomach starts cramping. But she notes in her video that it didn't feel like standard indigestion.
Still, her boyfriend ate the exact same meal and felt totally fine. So she had attempts to just sleep it off. But then, fast forward to 3 a.m., and her body just goes into full revolt.
She describes the pain as a 20 out of 10, comparing it to unmedicated childbirth.
Which is wild. She's projectile vomiting. She is literally convulsing and crawling on the bathroom floor for 8 solid hours.
And clinically speaking, that physiological response, the vomiting, the inability to stand, that indicates her central nervous system is being completely overwhelmed by pain signals.
Like an alarm system just screaming.
Exactly. It's her body saying an organ is in acute distress. But when she finally gets to the emergency room, she basically runs into a brick wall.
Yeah, according to her, a male doctor looks at her symptoms, hears about the midnight fast food run, and just dismisses this agonizing pain as a stomachache from the Taco Bell.
Which is so frustrating. In her video, she stressed how vital it is for women to forcefully advocate for themselves in medical settings.
And it really highlights a deeply entrenched issue in emergency medicine, doesn't it?
Oh, definitely. There's substantial clinical literature showing that women's pain is routinely underestimated and undertreated compared to men's.
Right. The doctor likely fell victim to anchoring bias. He heard fast food, anchored his diagnosis to food poisoning, and just, well, completely ignored the severity of what was right in front of him.
And the reality of what was happening inside her body only came to light 3 hours later when they finally performed a vaginal ultrasound.
This is where it gets cinematic. Brianna claims that during the scan, the ultrasound technicians audibly freaked out, like they literally gasped.
And then the doctor rushes back in and says, "We have to rush you in an ambulance to another hospital."
Because it wasn't a bad burrito, it was an ovarian cyst. And that's not even the wildest part. Wait till you hear what came next.
Yeah, it was specifically an ovarian cyst that had caused a severe mechanical emergency called torsion.
Let's break down the mechanics of that, because the phrase twisting ovaries is just horrifying, but I really want to understand how it actually happens.
Okay, picture this. The ovary is attached to the pelvic wall by a ligament, which houses the primary blood vessels feeding the organ.
So if a cyst grows on that ovary, it's kind of like a heavy piece of fruit hanging on a very thin branch.
That is a perfect visualization. When a cyst adds asymmetrical weight to the ovary, any sudden movement can cause the entire structure to just flip on that axis.
Ouch.
Yeah, and when it twists, it acts exactly like a kinked garden hose. The arterial blood might still pump in because arteries have thick muscular walls.
But the thinner veins meant to carry blood back out, get pinched shut,
Precisely. So the blood is trapped. It's pooling inside the organ.
which totally explains why Brianna said she had half a liter of blood sitting in her pelvic floor.
Exactly. The organ swells rapidly. Our medical source from VinMec explains that if this twisting isn't surgically reversed within hours, the restricted blood flow leads to ischemia.
Meaning the tissue is starved of oxygen.
Yes. And eventually it becomes necrotic. The ovarian tissue literally begins to die inside the body. That massive inflammation is what causes that paralyzing 20 out of 10 pain.
Now, in her video, Brianna repeatedly calls the cyst that caused this a giant cyst. And, when an influencer says giant, you picture something taking over her entire stomach.
Right, but medical definitions can be wildly different from colloquial ones.
So what does a truly giant cyst look like?
Well, to give you a clinical baseline, we pulled a case study from Korea MedSynapse detailing the removal of a genuinely giant ovarian cyst.
Okay.
The medical literature defines giant cysts as those exceeding 10 centimeters. But this specific case study involved a 26-year-old woman with a borderline mucinous tumor that had been growing for 4 years.
Oh, wow.
And by the time of her surgery, the cyst and its fluid weighed 58 kilograms.
Wait, let me pause you there. 58 kilograms. That is roughly 127 pounds.
Yeah.
That is basically the size of an adult human.
Yeah.
How does a person even survive a cyst that large without their internal organs being crushed?
It's due to the insidious, slow nature of the growth. Because they grow over a period of years, the body's mechanisms adapt. The abdominal wall stretches, the organs slowly migrate to make room.
Oh, so the pressure equalizes gradually? It is a slow-motion process, which is why it doesn't trigger the acute, sudden onset pain Brianna experienced.
Exactly.
Okay, so Brianna's cyst, while super dangerous, was definitely not a 127-pound anomaly. In fact, if her cyst was actively causing torsion, it couldn't have been that massive, right?
You've hit on a crucial biomechanical point. Medically speaking, cysts that are most prone to torsion fall into a very specific Goldilocks zone.
Like not too big, not too small.
Right, usually between 5 and 10 centimeters. If a cyst is smaller than 5 centimeters, it simply doesn't have the mass to pull the ovary out of position.
And if it's too big?
If a cyst is truly massive, say the size of a watermelon, it becomes lodged against the pelvic walls. It's too anchored to spin.
So Brianna's cyst was in that dangerous middle ground. Large and heavy enough to cause the organ to flip, but small enough to actually have the room to rotate.
That perfectly explains the surgical intervention she required. The looker mentioned she woke up with 5 small incisions across her stomach, including one in her belly button.
So she didn't have, like, a massive scar across her entire abdomen.
Because she underwent a laparoscopy. The VinMec literature details this minimally invasive procedure. Instead of slicing the abdomen wide open, surgeons make tiny half-inch incisions.
And they insert those thin tubes, right? Trocars.
Yes. One of these trocars goes through the belly button, acting as a port for a high-definition camera.
So they are basically creating a tiny illuminated surgical scaffolding inside her.
Exactly. And to give the surgeons room to work, they pump the abdominal cavity full of carbon dioxide gas, which inflates the belly like a balloon.
Oh, wow. Lifting the abdominal wall away from the organs.
Right. Once they locate the twisted ovary, they use specialized instruments through the other tiny ports to physically untwist the organ, drain the blood, and remove the cyst.
All while watching on a monitor. It's incredible that we have the technology to go in, untwist a dying organ, and pull out the culprit through a hole the size of a dime.
It really is. And because they aren't cutting through major abdominal muscles, the recovery timeline is drastically accelerated. VinMec notes patients are often discharged within 1 or 2 days.
Right. But later in the episode, we'll talk about the shocking twist nobody saw coming regarding her recovery. Because if you're loving these Hollywood twists, make sure you're subscribed. We've got even crazier stories ahead.
For sure. Because while the physical recovery from a laparoscopy is rapid, that speed introduces a completely modern complication.
A patient is discharged, they go home to heal, and within 48 hours of a major traumatic medical crisis, they are back on their smartphone.
Which brings us to the psychological arena of this story. If laparoscopy gets you out of the hospital in a day, your physical recovery starts fast.
But the mental recovery of being alone in bed with your phone and thousands of people scrutinizing your story is a completely different kind of trauma.
We spent time exploring the Reddit community, or Brianna Chickenfry snark, and it is a fascinating sociological space.
Oh, the digital detective.
Yeah. The users in this forum don't consume influencer content passively. They treat an emotionally charged vlog like a forensic crime scene.
Right, they look for inconsistencies. analyzing the narrative line by line to dismantle the influencer's presentation of reality. Let's deconstruct some of their specific pushbacks.
Let's start with that dramatic ultrasound room scene. Brianna painted this picture of the technicians audibly gasping and apologizing to her.
And multiple Reddit users who identify as healthcare workers or imaging technicians aggressively challenge this detail.
Because ultrasound technicians, or sonographers, undergo rigorous training to maintain a completely neutral clinical demeanor.
Right. More importantly, they are legally barred from diagnosing a patient.
Exactly. Because if they gasp in horror or say, "Oh my God, look at that," they are effectively suggesting a diagnosis.
Which is practicing medicine without a license.
Right. A sonographer's job is strictly to capture the images and pass them to a radiologist or attending physician for interpretation.
So while a tech might internally recognize a massive torsion, their external reaction must remain totally stoic.
And so the Reddit community viewed Brianna's claim of a cinematic gasp as a deliberate embellishment designed to amplify the storytelling.
Then there was the debate over the pain scale.
Hmm.
She claimed she was experiencing level 20 out of 10 unmedicated childbirth pain.
But the amateur detectives pointed out that she filmed this 5-minute YouTube video just hours after surgery.
Right, she was speaking rapidly, passionately, performing for the camera. The argument is that someone truly traumatized by level 10 pain wouldn't possess the bandwidth to seamlessly produce content so quickly.
This touches on a complex duality. I mean, pain is entirely subjective, and post-surgical adrenaline paired with heavy pain medication can certainly fuel a manic energy.
Oh, for sure.
However, the pushback reveals how audiences perceive the performative nature of content creators. The audience assumes that the instinct to produce overwrites genuine, raw recovery.
And that skepticism spilled over into her living situation, too. In the vlog, she claimed to be technically homeless.
Yeah, she explained that the emergency surgery caused her to miss her scheduled move-in date for a new apartment, and she felt incredibly guilty recuperating at her new romantic interests house.
But the snark community systematically dismantled the term homeless in this context.
They pointed out the factual inconsistencies. She holds an active lease for a luxury apartment, and she is comfortably recovering in a multi-million-dollar home.
So applying the word homeless to a slight logistical inconvenience was perceived as an attempt to artificially manufacture vulnerability and victimhood.
But you know, the most scientifically grounded criticism from the internet detectives revolved around a Prenuvo scan.
Right. A user pointed out that Brianna had recently undergone a full-body MRI. How does a full-body scan designed to catch early-stage tumors completely miss a cyst large enough to cause torsion just a short time later?
It's a completely valid question, but it demonstrates a misunderstanding of how ovarian cysts function. A Prenuvo scan is a static snapshot.
It takes high-resolution images of your anatomy on that specific day.
Exactly. But the ovaries are a dynamic, highly active biological environment. Functional cysts are a normal part of the menstrual cycle. They grow and resolve every month.
So a cyst can sprout, fill with fluid, and grow from a millimeter to 6 centimeters in a matter of weeks, long after an MRI was completed.
Yes.
If you are scrolling through TikTok and you see a celebrity in a hospital bed, your first instinct might be empathy. But the internet's immediate collective reaction was to deploy skepticism.
It makes you wonder why we are wired to instantly dissect someone's pain.
Exactly.
Yeah.
We are sitting here analyzing the legal protocols of an ultrasound tech just to prove an influencer might be exaggerating.
It speaks to a severe erosion of trust between creators and audiences. When someone's livelihood depends on capturing attention, the audience begins to assume that every life event is being run through a filter of optimization.
The audience assumes it is content first, reality second. But regardless of whether she embellished the gasp of a technician, the clinical reality is inescapable.
While the internet debates her choice of words, Brianna is navigating a diagnosis that alters the trajectory of her health.
Right. According to Us Weekly, she posted a very raw, tearful TikTok revealing the results of that much-debated Prenuvo scan. It confirmed she has Polycystic Ovary Syndrome, or PCOS.
And PCOS is an incredibly complex endocrine system disorder, and it explains the entire mechanical failure we've been discussing.
To understand why it happens, you have to look at the mechanics of ovulation, right?
Normally, an ovary develops a small follicle, which is a fluid-filled sac containing an egg. During ovulation, that follicle bursts, releasing the egg.
But with PCOS, that process misfires.
Correct. The hormonal imbalance, specifically elevated levels of male hormones called androgens, disrupts the cycle.
So the follicle develops, but it never receives the hormonal signal to burst and release the egg.
Instead, it just remains on the ovary as a cyst. Over time, multiple cysts can build up, altering the size and weight of the ovary, setting the stage for the exact torsion event Brianna suffered.
She seemed completely blindsided by this. In her video, she said her only symptom was occasionally missing a period when she was super stressed.
She didn't have the excess hair growth or the severe weight fluctuations that are often stereotypically associated with the syndrome.
She is presenting with what is often termed silent PCOS. The internal hormonal gears are grinding, failing to release eggs, but the external presentation remains relatively normal.
Right, and many women only discover they have this disorder when a cyst grows large enough to rupture or twist, or, more devastatingly, when they begin trying to conceive.
And that potential for infertility was the emotional core of her TikTok. All the polished influencer bravado was gone.
She was crying, admitting she was freaking out, and pleading with her community, asking, "Am I going to be able to have a baby one day?"
She was begging anyone with PCOS to talk her down off the ledge.
It is a moment of profound vulnerability. Facing the potential betrayal of your own reproductive system is terrifying, and it seems this acute realization of her own biological fragility is acting as a catalyst for massive career and life pivots.
The Us Weekly articles map out these shifts. After 5 years of highly profitable, drama-fueled content, she announced she is ending the BFFs podcast with Josh Richards and Dave Portnoy.
She explicitly stated she no longer wants to sit behind a microphone and talk crap about people. She is exhausted by the clickbait cycle.
When your body endures trauma, it forces a ruthless reevaluation of your energy.
Oh, absolutely. The superficial drama that previously fueled her career likely feels incredibly hollow compared to the reality of facing down chronic illness and potential infertility.
She's focusing all her energy on her solo show, Plan Bri Uncut, where she wants to pivot away from scandal and just be a best friend through their headphones.
She wants to write, direct, and actually connect.
And she noted that the timing of this medical crisis coincided perfectly with her recent stint on the reality show Special Forces, World's Toughest Test.
The physical and mental breakdown required by a military simulation show, followed immediately by emergency surgery, would certainly strip away any lingering illusions of invincibility.
She said going on the show made her realize something profound about being 26. She said, "You think your 20s are going to be the best and most fun years of your life? In hindsight, it's literally like, am I in hell? Is this actual hell in every sense of the way?"
Wow.
She's realizing that these intense trials, both the physical demands of the reality show and her body turning against her, are brutally forcing her to grow up.
It is the universal transition from early adulthood to true adulthood. It's the shocking realization that your body requires maintenance, that your career requires intention, and that a public persona built on drama can very quickly become a cage when you actually need space to heal.
So we've tracked a wild journey today. What started as a late-night Taco Bell run unraveled into a study of ovarian torsion, the marvels of laparoscopic surgery, the hidden mechanics of PCOS, and the relentless, unforgiving scrutiny of the digital detectives tracking her every move.
If there is a core truth to take away from this exploration, it is that in the modern digital landscape, there will always be a chasm between a clinical medical event and the narrative built around it.
Sometimes that gap is filled by a lack of scientific understanding, and sometimes it is deliberately widened to create compelling content.
Recognizing how and why that gap exists is the foundation of modern digital literacy.
It fundamentally changes how you process the stories on your feed. You stop seeing just the drama, and you start seeing the mechanics behind it.
You see the human being trying to navigate a biological crisis while simultaneously trying to manage an audience.
Which leaves you with a final thought to mull over today. Think back to the sheer physical terror of an organ dying inside your body. The pain, the emergency room lights, the fear of losing your ability to have children.
It's a terrifying reality.
Now imagine experiencing that visceral terror, but knowing that the absolute second you wake up from anesthesia, your surgical scars and your deepest fears will instantly become raw material.
Content to be consumed, debated, optimized for an algorithm, and relentlessly debunked by thousands of strangers.
Exactly. When our most vulnerable physical traumas become just another engaging plotline for the internet to pick apart, what does that actually do to our psychological ability to heal?
It's a heavy question. Stay tuned and hit that subscribe button so you don't miss what's coming next.
You've been listening to Starscope Report, where Jordan and Jamie uncover the stories shaping Hollywood, music, and pop culture. Thanks for tuning in, and don't forget to subscribe for more stories that keep the stars shining.